You are welcome to Comfort Bridge Healthcare Training. I'll be speaking on a crucial topic in healthcare and public health, infection control and safety. Specifically, we'll be looking at 4 core areas: hand hygiene and standard precautions, bloodborne pathogens and PPE usage, preventing the spread of infections, and emergency procedures, including fire safety and disaster preparedness. Let's begin with the foundation: hand hygiene and standard precautions. Hand hygiene is the single most effective measure to prevent the transmission of infections. Whether you're in a hospital, clinic, or even at home, proper hand washing with soap and water or using an alcohol-based hand rub can dramatically reduce the spread of pathogens. In healthcare settings, we follow the 5 moments for hand hygiene: before touching a patient, before a clean procedure, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. This brings us to the second area: bloodborne pathogens and PPE usage. Bloodborne pathogens such as HIV, hepatitis B, and hepatitis C can be transmitted through contact with infected blood and bodily fluids. To minimize risk, proper use of PPE is non-negotiable. Gloves, gowns, face shields, and masks serve as physical barriers between healthcare workers and potential sources of infection. It's essential to don and doff PPE correctly because improper removal can lead to contamination. Moreover, sharps injuries must be taken seriously. Used needles should always be discarded in puncture-resistant sharps containers and never recapped. If exposure occurs, it must be reported and managed immediately according to institutional protocols. Now let's look at the broader picture: preventing the spread of infections. This includes not just hand hygiene and PPE, but also respiratory etiquette, covering coughs and sneezes, isolating infectious patients, routine cleaning of surfaces, and vaccination. Infection control is a shared responsibility. Every individual, from healthcare staff to patients and visitors, has a role to play. Outbreaks can often be traced back to a small lapse in routine practices. Consistency is key. Surveillance, audits, and continuous education help maintain high standards. Remember, infection prevention is not just about compliance, it's about culture. Finally, let's touch on emergency procedures, fire safety, and disaster preparedness. In emergencies, chaos can compromise infection control. That's why preparedness is essential. Fire safety begins with knowing your environment, location of exits, alarms, extinguishers, and evacuation protocols. Regular drills and training save lives. Disaster preparedness includes protocols for disease outbreaks, natural disasters, or mass casualty incidents. Plans must account for continued patient care, protection of healthcare workers, and maintenance of hygiene standards. During pandemics, for instance, the demand for PPE, isolation rooms, and ventilators can surge. Preparedness ensures we don't run out when it matters most. Don't move a muscle. The next 10 minutes could save lives, including yours. Stay glued to your screen as we dive into essential tips on infection control and safety. From hand hygiene to emergency preparedness, this video is packed with life-saving insights you can't afford to miss. Let's begin.
Healthcare should be a haven for healing, a place where patients come to recover and regain their health. However, the reality is that hospitals and clinics, despite their best efforts, can sometimes become breeding grounds for infections. Sadly, these infections, known as healthcare-associated infections, or HAIs, pose a serious threat to patients, visitors, and healthcare workers alike. They can spread through various means, including contact with contaminated surfaces, medical instruments, or even through the air. HAIs can range from mild skin irritations to life-threatening bloodstream infections. These infections not only cause significant discomfort and pain to patients, but can also lead to severe complications, prolonged hospital stays, and even death. The impact of HAIs is profound, leading to extended hospital stays, increased healthcare costs, and a higher burden on the healthcare system. Families are affected too as they face emotional and financial stress. As healthcare professionals, it is our moral and professional duty to protect our patients from harm, including HAIs. This involves strict adherence to infection control protocols, continuous education, and a commitment to maintaining a safe environment. By understanding the principles of infection control and diligently applying them in our daily practice, we can significantly reduce the incidence of these preventable infections. This includes proper hand hygiene, sterilization of medical equipment, and the use of personal protective equipment. Let's delve into the essential knowledge and skills that every healthcare worker needs to master in the fight against HAIs. Together, we can create a safer healthcare environment for everyone. Through continuous training and vigilance, we can ensure that our healthcare facilities remain places of healing and not sources of infection. Join us as we explore the critical steps in preventing HAIs. Hand hygiene is the single most effective way to prevent the spread of infections. Our hands are in constant contact with patients, equipment, and surfaces that may harbor harmful germs. By performing hand hygiene frequently and thoroughly, we create a critical barrier that breaks the chain of infection. Effective hand hygiene involves more than a quick rinse under the tap. The World Health Organization recommends a specific technique for hand washing that ensures all surfaces of the hands are adequately cleaned. This technique involves wetting hands with water, applying soap, and vigorously rubbing the palms, back of hands, between fingers, under nails, and thumbs for at least 20 seconds. Hands should then be rinsed thoroughly and dried with a clean towel or air dryer. Personal protective equipment, or PPE, acts as our armor in the fight against infections. It is a critical component in ensuring the safety of healthcare workers and patients alike. By donning PPE, healthcare professionals create a barrier that significantly reduces the risk of transmission of infectious agents. Gloves, gowns, masks, and eye protection create a physical barrier that prevents pathogens from coming into contact with our skin, mucous membranes, and clothing. This barrier is essential in maintaining a sterile environment and protecting both the healthcare provider and the patient. Each type of PPE serves a specific purpose and should be chosen based on the level of risk involved in a particular task or procedure. For instance, some tasks may require only gloves, while others may necessitate full body protection. Gloves are essential when there is a risk of contact with blood, bodily fluids, mucous membranes, non-intact skin, or contaminated equipment. They are the first line of defense in preventing the spread of infections through touch. Gowns provide an additional layer of protection for our clothing and skin, particularly during procedures that generate splashes or sprays of bodily fluids. They are crucial in maintaining hygiene and preventing cross-contamination. Masks protect our nose and mouth from respiratory droplets, which are a common mode of transmission for many infectious diseases. By wearing masks, healthcare workers can prevent the inhalation of harmful pathogens, while eye protection shields our eyes from splashes. This is particularly important in environments where bodily fluids or chemicals may be present, ensuring that the eyes are safeguarded from potential hazards. Standard precautions are a set of infection control practices that should be applied to all patients, regardless of their known or suspected infection status. These precautions are based on the principle that any individual could be carrying infectious agents, even if they are not showing symptoms. By consistently adhering to standard precautions, we create a safer environment for everyone. Key elements of standard precautions include hand hygiene, the use of PPE when appropriate, safe injection practices, respiratory hygiene and cough etiquette, and environmental cleaning and disinfection. By integrating these practices into our routine care, we minimize the risk of transmitting infections from patient to patient, from patient to healthcare worker, and from healthcare worker to patient. Section 5. Transmission-based precautions, containing the spread. While standard precautions provide a baseline level of protection, transmission-based precautions are implemented when a patient is known or suspected to be infected with a highly transmissible pathogen. These precautions are designed to interrupt the specific routes of transmission for these pathogens, which may include contact, droplet, or airborne spread. Contact precautions are used for infections that spread through direct or indirect contact, such as methicillin-resistant Staphylococcus aureus, or MRSA, and Clostridium difficile, also known as C. diff. Droplet precautions are implemented for infections that spread through respiratory droplets, such as influenza, and pertussis. Airborne precautions are necessary for infections that spread through tiny airborne particles, such as tuberculosis and measles. Section 6. Handling hazards. Disposing of medical waste. Medical waste encompasses a wide range of materials that are generated during patient care, including sharps, blood-soaked dressings, contaminated equipment, and cultures. Proper handling and disposal of medical waste are crucial to prevent injuries and minimize the risk of infection transmission. Sharps, such as needles, scalpels, and broken glass, should always be disposed of in designated sharps containers that are puncture-resistant, leak-proof, and labeled with the biohazard symbol. Never recap needles or attempt to bend or break them, as this increases the risk of needle stick injuries. Blood-soaked dressings and other contaminated materials should be placed in biohazard bags or containers that are clearly labeled. Section 7. Navigating infectious diseases protocols and procedures. Hospitals and healthcare facilities have established protocols and procedures for managing specific infectious diseases. These protocols outline the necessary steps to identify, isolate, and treat infected patients while minimizing the risk of transmission to others. It is essential for healthcare workers to be familiar with these protocols and to follow them diligently. When a patient presents with symptoms of an infectious disease, healthcare workers should immediately implement appropriate infection control measures, such as isolating the patient, donning appropriate PPE, and notifying the infection control team. Specimens should be collected and sent to the laboratory for testing to confirm the diagnosis. Treatment and isolation procedures should be tailored to the specific pathogen and the patient's clinical condition. Section 8. Real-world scenarios, infection control in action. Let's consider some real-world scenarios to illustrate the importance of infection control principles in everyday practice. Imagine a nurse caring for a patient with a draining wound infected with MRSA. By adhering to contact precautions, including wearing gloves and a gown, the nurse prevents the spread of MRSA to themselves and other patients. In another scenario, a healthcare worker develops a cough and fever. By following respiratory hygiene and cough etiquette, including covering their mouth and nose when coughing or sneezing, and performing hand hygiene frequently, they reduce the risk of transmitting respiratory droplets to colleagues and patients. Section 9. Champions of safety. The vital role of infection control. Infection control is not just the responsibility of infection control practitioners, it is everyone's responsibility. Every member of the healthcare team, from doctors and nurses to support staff and administrators, plays a crucial role in maintaining a safe environment. This collective effort ensures that we minimize the risk of infections and protect the health of everyone in our facilities. As healthcare workers, we are all champions of safety, and our actions can have a profound impact on the well-being of our patients. Simple actions, such as proper hand hygiene, wearing personal protective equipment, and following protocols, can make a significant difference. These practices are not just routine tasks, they are vital measures that safeguard lives. By embracing infection control principles, we create a culture of safety that protects patients, visitors, and ourselves. This culture is built on continuous education, adherence to guidelines, and a commitment to best practices. It is about fostering an environment where safety is prioritized, and everyone feels responsible for infection prevention. Let us remember that infection control is an ongoing journey, not a destination. It requires constant vigilance, regular training, and staying updated with the latest research and recommendations. The landscape of healthcare is always evolving, and so must our strategies to combat infections. By staying informed about the latest guidelines, being vigilant in our practice, and never hesitating to ask questions or seek guidance, we can ensure that our healthcare settings are havens of healing, not sources of harm. Open communication and teamwork are essential in this endeavor, as they help us address challenges and improve our practices continuously. Together, let us strive to provide the safest possible care for every patient, every time. Our dedication to infection control reflects our commitment to excellence in healthcare and our unwavering resolve to protect those who trust us with their care. By working together, we can achieve a safer, healthier future for all.
Welcome back. Great to see you again. Up next, we'll walk you through proper hand washing techniques, simple steps that make a huge difference. Stay tuned and let's master it together.